Okay, ladies and gentlemen, thank you for standing by. Welcome to the coronavirus update. At this time, all participants are in listen-only mode. If you should require assistance during the call, please press star then zero. I'd like now to turn the conference over to our host, Senator Steve Glazer. Please go ahead.
Thank you very much, operator. Hello, everyone. Welcome to my 20th coronavirus town hall. When we hosted the most recent of these conversations over the summer, I was hoping to not have to do another one. While California has twice reduced the spread of this deadly virus, we have not eliminated it or come close to flattening the curve. It seems that every time we let our guard down, it surges again, and now it's back and spreading faster than ever. The 7-day average of cases that we're experiencing right now is the greatest so far in California. The positivity rate of those who have had tests done is about 5.6%. That's up 50% in the last 7 days. The Secretary of Health yesterday indicated that 12% of cases end up folks being in the hospital. Yesterday we had 11,478 new cases just yesterday. That would add about 1,200 more people into our hospitals. So a lot of stuff going on, not so good. In response to what is happening and the dangers that we are facing, Governor Newsom and local health officers have ordered renewed restrictions on social interactions. We're going to hear from those local health officers in just a moment. The CDC has advised people to avoid Thanksgiving travel and to limit gatherings to those within their own household. I'm joined in this conversation today by my colleague in the State Assembly, Assemblymember Tim Grayson. Tim, thank you for being on these calls.
Thank you, Senator. Appreciate the invite and appreciate what you're doing to help keep the community informed.
So we have invited people to ask questions that we can ask our guests. We've received about 3 or 4 dozen of them so far. You can continue to send questions in by sending an email to my website. That is senator.glazer@senate.ca.gov. That's addresses in the invitation that I think most of you have received. Today we have 3 guests who can answer your questions about the latest surge, what's causing it, and what we can do to keep our families and friends safe in the weeks ahead, and also to talk about these new vaccines that we've been reading reports about. We're going to touch upon the impacts on schools, on science, on economic relief, and there's been a bunch of questions on politics. My guests are Dr. Nicholas Moss. He is the Chief Health Officer for Alameda County. He started with the county health office in 2013 and recently took the helm as the Chief County Health Officer. Dr. Moss, you were born in the Bay Area. I understand you're a graduate of UC Berkeley. Go Bears. You received your medical degree from the University of California, Irvine, and you were trained in internal medicine, infectious disease medicine, and public health at the University of Washington in Seattle. Dr. Moss, welcome.
Thank you so much, Senator Glazer. Thank you for having me on here. These calls are great opportunities to reach out and appreciate all you're doing and all the state is doing to support the COVID response. Also glad to be on with Dr. Civielli, my close colleague in Contra Costa, and also Dr. Walker, who's been doing so much to really provide good information about COVID, which sometimes can be surprisingly hard to come by.
Dr. Moss, hold on one second. Let me finish the other introductions, then we'll come back to you.
Oh, sorry, I got confused.
No problem. So, and you mentioned your good friend, Dr. Ori Civielli. He's the Deputy Health Officer for Contra Costa County and Medical Director of the Division of Public Health. He is a family medicine specialist, has over 20 years of experience in the medical field. He also earned a bachelor's and master's from UC Berkeley and graduated from the University of California, San Francisco School of Medicine in 2000 and has had an affiliation with the Contra Costa Regional Medical Center. Dr. Civielli, it's nice to have you back. I think it's the 3rd time you've come on these telephone town halls, and it's always nice to have you in the conversation.
Nice to be here. Thanks.
We're also joined by Dr. Robert Wachter. He is a professor and chairman of the Department of Medicine at UC San Francisco. Dr. Wachter, you earned your bachelor's and medical degree from the University of Pennsylvania, and you trained at UCSF before joining the faculty there. I know that you are an author of 300-plus articles and 6 books, and maybe the most quoted expert on the COVID virus in California, if not the nation. Dr. Wachter, so nice of you to be a part of our conversation today.
Thank you, Senator. It's an honor to be here.
So let's begin with Dr. Moss. The new health orders, what does it mean for Alameda County? How are things changing now? And can you give us the view from the ground in Alameda?
Sure, and my apologies to the panel for jumping in a little early. We have seen a substantial increase in our cases, our rate of cases for COVID in Alameda County over the last 2 weeks, but things have continued to accelerate, and we, by state action, we were moved into the most restrictive tier of the state's, what they call the Blueprint for a Safer Economy. That's the state's framework that guides reopening and unfortunately reclosing of activities in counties according to what's going on with the COVID pandemic. And so, although we're in the highest tier, Alameda County, I think, overall has done pretty well, and we're hopeful that the things that our residents have done and our businesses have done to help us contain COVID in the county will continue. And with the newest restrictions, some of the in broad terms, what we're asking people not to do, and what the state has required, is to avoid indoor settings, indoor dining, movie theaters, family entertainment settings, like those are like bowling alleys, also gyms. Any of these indoor activities, particularly ones where masks come off, they're not permitted under the state health order when we're in the purple tier. And so that is really the big change this week from last week. We're hopeful that we're not going to be in this situation forever, but we do think that this action is going to help contain COVID, here in Alameda County and across the state, where many jurisdictions are in the same position.
Now, Dr. Moss, can you explain to people that they feel like we've been doing things right, that the spread has been low, and you had Alameda County had moved down into the highest tier is purple, then followed by red, and then orange, and then yellow, and then I thought Alameda County was in the yellow tier just a week ago. The orange tier just a few weeks ago. Is that right?
Yeah, that's right. Actually, last week we were in the orange tier, even as we saw our numbers beginning to worsen. The state's framework moves a little bit slowly, and in fact, what they did at the California Department of Public Health is they saw that things were moving very quickly, and they sort of sped things up. They're using more up-to-date data, and they've asked counties to apply the tier restrictions faster than they were. So things ended up moving quite fast. I think that's appropriate in this case. We know with COVID, days matter, and with the day-over-day increases in cases, I think it's the best thing for public health to move quickly with reapplying restrictions. But it was quite fast, and we understand that's a strain on our residents and businesses. And I don't think it's a sign that what we were doing in Alameda County didn't work in terms of coming out of the summer surge and really keeping things under control in the fall. But COVID's difficult. We're impacted by our own reopening as well as what's going on across the state and across the country. And I think there's a lot of things that contributed to this most recent surge. And really, it's a time for us to redouble some of those efforts that made us successful before, and not view this as any kind of of failure. But
okay.
COVID is tough.
Okay, and I'm gonna bring this part of the conversation to Dr. Wachter in just a moment. But let me go to Dr. Civielli. to give us the ground floor view of Contra Costa County. Again, same kind of question. I thought we were doing well. We'd moved from purple to red to orange, and then within a day now we're back at purple with serious restrictions again. Dr. Civielli, give us your view of what's happening in Contra Costa.
Yes, thank you. It's very similar to what Dr. Moss was describing for Alameda County. We started seeing our numbers really trending up a couple of weeks ago, and then the shape of the curve sort of started pointing straight up. So the numbers went up very quickly. So we went from orange to back to purple within essentially a week, and we also feel that was an appropriate adjustment in restrictions because the number of cases were so high. We have now over 22,000 total cases in Contra Costa, about 2,000 in the last 2 weeks, and about 257 people have died. We've also seen our hospital census increase, which has been concerning. In early October, we were down to 18 COVID-positive patients in county hospitals. We're now up to 68. So that's a threefold increase. So that's a big reason why we think the tighter restrictions are appropriate. We don't want to run out of hospital capacity. We're not close to that yet. We still have plenty, and we're working with our hospital partners closely. But we're concerned that if things were unchecked, things could get pretty hairy. We do have a lot of the community is testing more now. We've set a record for the number of tests every weekday this week. More and more people are testing. There's more demand. More people are calling our testing sites, and I'm hearing the same thing from Kaiser and John Muir, as well as San Ramon, the hospitals in San Ramon. So that's a good thing. We think finding cases is good. Our turnaround time for lab results is, in general, still quite good, generally under 3 days. So we're happy that people are testing.
So Kathy writes in and she says, where are people in Contra Costa becoming infected? I check the Contra Costa Health website every day, and the infections and death rates inform my daily actions, but there's no contact tracing information, so I can't tell where the dangers are. How is COVID-19 spreading in Contra Costa, and specifically for me in La Miranda? What would you say to Kathy?
Great question, Kathy. First, for those of you who want to check, you can go to coronavirus.cchealth.org, and you see some great dashboards there, including if you click on the overview dashboard and scroll all the way to the bottom, you can see cases by city, including in the last 14 days. So that will give you a sense. In general, in Contra Costa County, the biggest burden has been along what we call the Highway 4 corridor and Monument Boulevard. So, Richmond, San Pablo, Bay Point, Pittsburgh, Antioch, Brentwood, and Monument Boulevard in Concord. But I will say that the trend in the last couple of weeks has been that the more suburban areas have been catching up. They don't nearly have the same number of cases, but the gap is narrowing. So we're seeing more cases in Danville, San Ramon, Orinda, Moraga than we were seeing earlier in the pandemic.
Very good. Ken writes in, and he says, I have questions on the curfew, and this is a curfew the governor is putting in effect, I believe, tonight, Saturday night, or this coming Saturday night. Ken writes, what activities are allowed between 10 p.m. and 5 p.m.? Can he go for a walk? Can he walk with his family? And what's the scientific basis for implementing this type of a curfew? Dr. Boss, Dr. Civielli, any thoughts on that before I turn the conversation to Dr. Wachter?
Sure. The state's limited shelter-in-place order going into effect Saturday will impact Alameda County because we're in the purple tier, and that's where it applies. And so the order is really designed to prevent gatherings, people gathering together, also businesses that are settings where people are grouped together. It's really focused on limiting those after hours or from 10 p.m. to 5 a.m. because we know that those settings are where COVID transmission occurs. We know that from lots of published evidence at this time, and lots of work by the CDC and public health authorities around the country and around the world looking at where transmission happens. And people wonder why those hours. Well, I think the important thing to realize is just limiting the opportunities, the hours that people can get together when COVID is very widespread in a community is more important perhaps than picking the exact perfect hours, right? So you're just limiting the amount of time that people can engage in activities where there's more likely for transmission to occur. But people can still take care of their essential needs. They can go to the grocery store. They can go to the drugstore. They can walk their dog. Those are the examples that the Secretary Galley shared, I think yesterday. But just representative examples. So it's not where you can't ever leave your house. It's really focused on avoiding those gatherings where people are at risk of catching COVID.
Thank you, Dr. Moss. Dr. Walker, let me bring you into the conversation. You have an international, national, attention span here, not just California. And previously, we saw what was happening in New York in the spring, New Jersey, and it wasn't really California, but we took quick steps to build up our capacity in case the virus came here in the same ferocious way. We've watched cases spiking in other states, and yet we're still seeing in the Bay Area that things are, pretty much still under control at some level. Can you speak to what the experiences you've seen across the country and the world, and why this quick reaction here in California?
Well, yes, thank you, Senator. I think it's important to keep in perspective that California as a whole has done reasonably well. Obviously, we've had our share of tragedies, but has done reasonably well over the course of the pandemic. And Northern California in particular has done extraordinarily well. There's a metaphor that I like. It was actually put together by a San Francisco resident named Thomas Pollo, who wrote in the beginning of this about something called the hammer and the dance. And the hammer and the dance is sort of the way you survive a pandemic. The hammer is you close everything down. That was March and April for all of us. The dance is as you begin to open things up, the virus begins to find targets and spread. And the dance is being careful and thoughtful about that, as the governor talks about the dimmer switch, that you're basically trying to coexist with the virus, and as things begin taking off, you begin shutting things down to try to keep the virus at bay. We have done the dance better than any part of the United States, and as one piece of that, this is San Francisco, but the Bay Area as a whole is similar. San Francisco, as of today, has had 156 deaths, 156 since this started. If the U.S. had San Francisco's per capita death rate, we would have had about 60,000 deaths in the United States, and as you know, we hit 250,000 2 days ago. So that would be 190,000 people would be alive today if the country was mirroring in a huge way in March and April. We saw what happened in New York, and in early June things began to surge in California, and our local leaders, including you and others, and the others on the call, basically said, folks, it's time to get serious. We've let our guard down and we've become a little complacent. And lo and behold, Northern California turned it around very, very quickly. Tragically, Southern California did not. Los Angeles is up to over 7,000 deaths. So past success is no guarantee of future success, but the precedent here has been that Northern California has been uniquely good at saying, okay, it's time to get super serious about that. The situation nationally is disastrous now. This surge, first of all, comes after each surge. We don't go down to baseline. We stay at a higher level. So we're beginning at a higher place than we did for the second surge, and certainly there was nothing before the first surge. So we're starting from a higher baseline of cases, and we are surging faster and bigger and more geographically dispersed than we did with the first two. The first was the Northeast, the second was the South, and to some extent California. The third is everywhere, but it's not the same everywhere. The Midwest is cataclysmic. right now. 900 physicians and nurses at the Mayo Clinic are out of work because of COVID. It's almost an unbelievable number. It's a big place, but it's not so big that it can survive that kind of loss. The numbers in the Dakotas are extraordinary. We have done things right in part because the leaders, including those on the call, have been decisive and have followed the evidence. And just as importantly, the citizens of our area have taken it seriously. You don't hear talk about this being a hoax. You don't hear a whole lot of pushback about masks and other things. It is uncomfortable. Everybody would love to go back to normal. But the best way to get back to normal is to follow these sensible, evidence-based recommendations. And I'm hopeful that we will turn this around in California. One last comment is that we are seeing a big uptick in cases in San Francisco, about 3 or 4 times what we had a few weeks ago. Hospitalizations are up a little bit, but not massively yet, and that's fine. Now, hospitalizations will follow cases as night follows day. It will happen, but at least so far, as the others have said, the hospital systems are not being stressed, and we don't want to test that. I mean, part of the reason we've done so well is our hospitals have never gotten to the point they were overwhelmed. And when they do, several of my colleagues went to New York in April when it seemed clear we were doing okay here. It's a different world. I mean, people really do die if, rather than a nurse taking care of 1 or 2 ICU patients, as would happen at UCSF today, a nurse is taking care of 8 or 10, which is what happens in a place like Iowa or the Dakotas today, or New York in April. So it's really important that we turn this around, and I am reasonably confident that we will.
Dr. Wachter, let's stay a little bit globally for a moment with a couple questions that have come in. Barry asks, why does China, with a population of 1.3 billion, have only 4,000 reported deaths, but the U.S., with 300 million, have 250,000 deaths? What would you say to Barry?
Well, there are things about the American society and American culture that I and we love, but being great in a pandemic is probably not our core strength. There's a writer for The Atlantic named Ed Yong who's written brilliantly on this and wrote a fantastic piece a few months ago talking about how many of the American characteristics of individualism and prizing liberty and individual choice and exceptionalism and don't serve you well during a pandemic. You probably will do better in a pandemic in a more authoritarian environment where there are top-down rules and regulations and very clear consequences if you don't follow them, and therefore everybody does. Now, that's not the way I want to live my life, and I think overall the advantages of our way of doing business outweigh disadvantages, but in the case of something like this, China has a big advantage over us. They were also the first place that was hit, so they got their act together very quickly and recognized that they needed to. And they have, at a national level, they have developed a set of systems that everything related to testing, contact tracing, using technology that are better than the ones that we have, certainly the ones that have been developed and promoted at a national level. That may change with a change in leadership. We will see. I'm hopeful about that. But you would not look at the American response to this and give it anything other than a D grade. And I think California, and Northern California in particular, would get a much higher grade. But there are advantages in, and one last comment is in the Asian countries, they're used to pandemics. They have had more widespread infectious disease threats, and having gone through that before, mask wearing was a more natural act than it has been here. My hope is we'll emerge from this and we'll be better at the next one, but we have not done very well in this one.
Thank you, Dr. Wachter. There is some who suggest that China has not been forthcoming and as accurate with their information about spread and fatalities. Sonia writes in, and she, on a similar line, she says, I sometimes wonder why countries like Singapore, Taiwan are able to control the virus, but we can't. I've come to realize people just are not following the rules here as they are there, and that people wear masks in Singapore. They get fined or put in jail if they don't comply. And she asks, and I guess this is a message to our friends in Contra Costa and Alameda County, is there some way that we can deal with this noncompliance to force people to wear masks? So she has that global view as well. Speaking of masks, we've gotten a number of questions from people about whether what is the type of mask that is safe. As you all may recall, early on in this pandemic in March, we were told that masks don't make a difference, and it came to be that it was suggested that that was more about trying to preserve the limited mask supply for those who were on the front lines. And then it wasn't until June that Governor Newsom put a mandatory mask order in place, and yet that still is not in place in our country. But people have asked about face coverings and what's working and what doesn't work. Dr. Wachter, anything to say about masks today? They're obviously important. The type of mask. Any insight there?
Sure. I mean, first of all, what people said in February and March, the fact that then became sort of a source of disinformation is incredibly disheartening. There were plenty of things we didn't know in March, and I've yet to see a patient come in the hospital and say, "Don't give me steroids because you said in March you didn't know that they worked." Turned out we found out in April when we did studies that they work, so we give them. So scientific knowledge is always evolving, and that's just the nature of the beast. And one of the more disheartening things about this is that masks have become this sort of political football and emblematic of what team you're on, as opposed to a perfectly reasonable, completely evidence-supported intervention that at low cost would markedly decrease the rate of cases. And part of the reason we've done so well in Northern California is our rate of mask wearing is higher than virtually any other part of the country. So there's no question, very good studies say that we would have prevented probably 3/4 of the deaths if we had near universal mask wearing. So you should wear them. I should wear them. I'm glad that we have a mandate and everybody should do it. The N95, which is the kind that we have in the hospital for when we're taking care of COVID patients, is somewhat better than a surgical mask, which is a little bit better than certainly a flimsy cloth mask. But any mask is better than no mask. Don't use one like the people use in the fires with a valve, which defeats the purpose. You then breathe out COVID. One of the superpowers of COVID, of course, is that we now know that 40% of people that have it and are infectious have absolutely no symptoms at all. So the fact that you feel fine is not a guarantee that you don't have it. The fact that you're in the supermarket with other people that feel fine is no guarantee that no one has it there. And so the only thing that we can do, it really is the most effective of all the maneuvers, is being sure that everyone is wearing a mask when they're around other people. And if we all did it religiously, we would markedly cut the case and the death rate.
Assemblyman Grayson, you have a question?
Thank you, Senator. And I know that when the governor pulled the emergency brake and the state, a lot of the counties were put into the purple tier. Is there a pathway for each county to work themselves out of the purple tier by practicing safe methods like wearing masks, distancing, and closures and curfews? And if they are to bring their numbers down, or do the counties have to wait and move back into the next tier together?
Why don't we go to Dr. Moss, the Chief Health Officer of Alameda County? Do you want to weigh in on Assemblymember Grayson's question?
Yeah, good question. My understanding is that the state hasn't changed anything about how we can move back out of the purple tier. We have to get our case rates down in Alameda County below the threshold for the red tier. We have to get our test positivity, that's the proportion of tests done across the county that are positive. We have to get that number down below the threshold for the next tier, and then we can move back down. And I'm hopeful that we will be able to do that. I don't think it's a thing where the state will move counties together. I think they're going to stick with their framework.
Dr. Civielli from Contra Costa County, anything to add to that?
No, Dr. Moss is exactly correct. I think we still, by doing things right, by wearing masks, by distancing, by not gathering, we can reduce our case rate and move down to the red and orange tiers again. One of the differences is the state used to look at things once a week, and I think now they're looking at things once every 4 days. So they're really keeping a very close eye on things, and we're happy that they're doing that.
Great. LK writes in to say, I don't understand why some restaurants have tents with enclosures on 3 sides and a roof, and that is considered safe. Dr. Civielli, in Contra Costa County, restaurants obviously are doing everything they can to survive, and a lot of them are in a big amount of hurt. and they're trying to keep business going, and so they have opened up spaces outside, and they have put tents around them. What's allowed in Contra Costa County? What are you looking for to make sure that if you were going to dine out, that it's being done safely?
Yeah, the state guidelines for what's considered outdoors is 3 open sides. So I think this caller was describing 3 closed sides, so that would not meet the state guidelines. We do have our environmental health division, which is the same people that normally give restaurants their inspections and licenses, going out and taking a look at this. So if anyone is seeing something that is concerning, please call our enforcement folks, and they'll go out and take a look. And usually we take an educational approach. I do agree that the restaurant industry is really, really suffering right now. It's a big deal. It's been a long time. It's probably going to continue for a while. And I think that as a government, we should be looking to see how we can help our small businesses whose operations have been interrupted.
Very good. Anything to add to that, Dr. Moss from Alameda County?
No, I think things look very similar to what Dr. Civielli described in Alameda County.
All right. Martha writes in. She says she's a healthy retired senior. How stringent should be on isolating? Would you stay out of the grocery store and order deliveries? Would you go anywhere indoors at all? Who would like to take answer Martha's question there?
I guess I'll take a stab as Bob Wachter.
Go ahead, Dr. Wachter.
Sure. The answer is you have to. Everyone's going to have to make individual risk decisions, and a lot of this would depend on what the test positivity rate is in your environment and what your own individual risks are. In general, we know that if you are in a store and the store is being careful and following the guidelines in terms of how crowded it is, the distance you're keeping from other people, and everyone is wearing a mask, it is essentially perfectly safe. And when I say essentially, it means that it's theoretically possible there could be transmission, but there are very, very few cases that have been transmitted in that kind of environment. And so if you need to go out and shop to feed yourself, you should do it. The older you are or the more comorbidities you have, meaning other medical illnesses, the riskier it is if you do happen to get the virus. And the thing that sometimes people don't understand is the risk of any individual encounter is made up of 2 things. One is how risky is the encounter, meaning were people wearing masks, how close apart were they, and that's got to be multiplied by the chances that the person you're encountering has COVID, and it can be asymptomatic. And so the risk of an encounter in an environment where the test positivity rate is 1% is lower than if that test positivity rate is up to 5%. It's just an increasingly likely thing that one of the people that you're going to confront is carrying the virus. So those are the things I pay attention to, but in general, being careful and thoughtful about how you do your activity, certainly walking outside, going to the store if everyone is masked and you keep your distance, those are safe things to do, and I would not be reluctant to do those things.
Very, very good. I want to get to the issue of the vaccine and schools, but there are some more questions coming in that are a little more pragmatic. Maria writes in about going to a restaurant where she saw a lot of kids sitting at a patio without a mask. She says, are the police enforcing this? Should the restaurant staff have done something? Should she have done something? And notes that she decided it was not safe for her and she left the area immediately. Dr. Civielli from Contra Costa, what kind of enforcement is being done in this county?
The enforcement in this county is done by a combination of local law enforcement, county sheriff, and environmental health. So most of the enforcement is focused on education. Repeat offenders, the County Board of Supervisors did pass a fine system for people who are not complying in a repeated way. So it's very much dependent on members of the public letting us know about their concerns And I think this caller made the right call. If things don't look safe to you, there's no reason to stay there and put yourself at risk.
Very good. Betsy writes in, she says, from her point of view, everywhere she goes, she sees people wearing masks, social distancing, people being responsible. And she says, I'm curious, if we're doing all these things, why is it still spiking? Dr. Wachter, there's a lot of people out there that feel that way, that they're being responsible, they see people being responsible. So how could we be spiking in such a significant way?
The virus is a pretty wily foe, unfortunately, and think about the number of people and the number of encounters, and it's hard to get your mind around this idea of exponential growth. That if you have one person, they might give it to 2, who might give it to 4, who might give it to 16. It's an impossibility in as open a society as we have, that we could have kept the case rate to 0. It's not going to be possible until we completely beat this thing, and I think vaccines will be important with that. And so, but I think there is COVID fatigue. It has set in. You do see people being less careful. It may be that they're careful when they're in the store, but they're getting together with a group of people in their house, or going out in other ways. So it really is sort of math and physics. It's just there are more encounters with people who were infected, who have let their guard down, and that infect someone else, who will then infect a few other people. And of course, we need to pay attention to these issues of disparities and people living in crowded conditions and people who have to work and can't not work. But we know that there are things like restaurants. I mean, restaurants are particularly tough because by definition, people are going to take their masks off. No other reason to be there other than to eat. And so that's why it's particularly important as cases begin to spike. You have to take some of the things that are particularly risky and unfortunately back down on that level of openness.
Thank you for sharing that. We've gotten about a dozen questions about schools, a lot of frustration from parents. This homeschooling, remote learning thing is just not working for many. It's one of the many tragedies from this virus that we're all experiencing. And these questions are of frustration. I'm going to bring in Dr. Tivielli in Contra Costa, at least start there. Can you briefly explain how we're handling schools? Private schools seem to be getting some waivers. Are they spreading the virus? Do we have any information about that? Do we have the right strategy where we're closing gyms and bars, and schools too? Or people are trying to understand the proportion of if the virus isn't spread that much among kids, or they're affected that much, why are we being so strict? So there's a lot of stuff that's coming from folks. Could you take a shot at answering some of those concerns?
Sure. The school questions are really some of the toughest ones out there. It's clear that the remote learning works for some students, but really doesn't work for many. And it is frustrating for parents. It's not great for education. I think it's something that sows fear often in the hearts of teachers who may be exposed. And it's just a really tough question. So right now, the status of schools is schools that began opening while we were in the red or orange tier can continue to open. But now that we're back in the purple tier, schools that did not start their opening cannot start unless they are an elementary school that asks the county for a waiver. And that process is continuing. When we get waiver applications, we review them, we pass them on to the state, and the state can approve them. I just looked at our numbers for Contra Costa County. In general, we have not seen a lot of transmission in the schools. Most of the schools that we've had open have been private schools that asked for waivers last time we were in the purple, and mostly elementary schools. I think we've had over 6,000 students in school in the last couple of months, and I think we've only seen 40 transmission events and no outbreaks. So there were isolated transmission events that were interrupted. So that's good, but we haven't had a large-scale reopening the way some other cities have. it's a really, really tough call. The rules are for reopening are set by the state, and I know that they're looking at it very carefully all the time. That they are seeing the real harm that some students are suffering by not being able to go to school. It's also a workforce issue. Practically when parents have no childcare, and their kids are at home, they often can't go to work. So a real concerning issue. Luckily, we are not seeing a lot of transmission in schools. I don't know if Dr. Wachter can give us the more national perspective on school transmission.
Yeah, not much to add. I mean, it is clear that the younger kids up until about age 10 or 11 seem to have a lower rate of transmission, which has been one of the few pieces of good news in all of this and sort of happy surprises. But it's not zero. And I think your take on this is exactly right. It really is a tough question. The trade-offs are palpable. Everybody knows that if we can get the kids back to school, it would be great. But also, everybody knows that you're not only potentially putting kids at risk, but you're putting the adults around them at risk. So it is just a brutally hard call.
Jill writes in, angry that Alameda County schools are not allowed to reopen. HD writes in to say that San Ramon, he thinks they're moving too fast. There's a lot of opinions out there from anguished parents. Al writes in to say that if there's a vaccine, the teacher should get them first. Boy, I sure like that idea. And maybe that's a good transition to the issue of vaccines. Dr. Walker, we've heard some exciting news about 2 different types of vaccines that may be available. I have a lot of questions about them from people, but maybe you could give us the broader view of what's happening now and what does that mean going forward.
Sure. The broad view is that the news on vaccines is remarkably good. It's just almost unbelievably good. And when I say unbelievable, people may say, "Oh, should I not believe it?" No, the answer is we're quite sure that it is accurate, and it is just good beyond what our dreams were as of about 10 days ago. Until we've been working on an HIV vaccine for 30 years, we don't have one. And so the fastest vaccine that ever happened from the time an infection or people started working on it to developing the vaccine was 5 years. So the idea that we now have 2 vaccines that have been demonstrated to be 95% effective in preventing cases appear to be quite safe, at least in people who have been observed now for 2 full months, is remarkably good news. The fact that it happened in 10 months, I think kudos to the administration on this one. I think they got it right. And the stage we're at now is that Pfizer, at least, and I believe Moderna in the next few days, will make applications to the FDA for emergency use authorization. That will take a week or 2 for them to pour through 100,000 or so pages of documents, but there's essentially no doubt that they will grant that use authorization. One of the things that Operation Warp Speed did was not only fund the development of the vaccines, but also fund their distribution. So they are essentially ready to go as soon as they get that authorization. So it is not out of the question that we can have people getting vaccines as early as the 2nd or 3rd week of December, which is just staggering. The first groups are likely to be healthcare workers who are having direct patient contact. And that's nurses, doctors, emergency medical workers, people working in nursing homes, and particularly older patients, maybe particularly in congregate living settings. So we've got to sort of figure that out, how they're going to get distributed, where all of that is being worked out. If you do the math in terms of how much vaccine these companies have available by mid-December, you would say that probably it's December, January, maybe February before you vaccinate those 2 groups of healthcare workers and people at particularly high risk, and it's probably May, June before you vaccinate most of the country and get anywhere near this whole discussion about herd immunity, where you have 50 or 60% of the people vaccinated. So while I'm incredibly excited about this, and I hope you hear that in my voice, if you do the math there, the amount of time between now and that wonderful day that we have the majority of people vaccinated, and now and the the start of the pandemic is about the same, meaning we're at about the 50-yard line in terms of widespread vaccination. But that shouldn't temper our enthusiasm about this. It's a remarkably positive development, and nobody saw 95% efficacy coming. Even optimists were saying maybe this will be 75 or 80% effective. Nobody thought it would be 95%.
A listener writes in, I think pronounce her name, Arch Anna, who says that she understands the importance of immunizing healthcare and essential workers first, but what about the elderly and followed by children? Any thoughts about the order of this beyond essential workers?
Well, the elderly and healthcare workers are sort of in the same first group, and so there's no question that the elderly, particularly people in nursing homes where the toll has been extraordinarily high, but people over 65 will be in the first group, and probably in that group or maybe just after them will be people younger than that but who have significant risk factors for a bad outcome. The risk of spread to everybody is about the same. It really is what happens if you get it. And so in terms of which patients get it first, you would really want to start with those at the highest risk of dying or being very ill if they got it. Kids are relatively low on the list. In fact, the tests have mostly not looked at kids. We wanted to be sure it was safe for adults before doing a whole lot of testing in kids. So I don't think you're going to see students as an early part of the group. Where do teachers fit in? They fit in the hierarchy a little bit higher than the general public, but after elderly and healthcare workers in terms of the plans, at least as they stand now for allocation. That may change a little bit as the CDC weighs in on that, but that's the plans as they are rolling out now.
Jonathan writes in, wants to understand, a number of people have written in trying to understand the difference between the two different vaccines. Is there anything measurable that you see right now between those two vaccines, the Pfizer and Moderna?
Not really. I mean, the only thing that, in terms of the results, they turned out to be almost precisely the same within the margin of error, that they prevented 95% of cases. So equally effective, not surprising. They both use a technology called mRNA. That's a brand new technology, but they're doing the same thing, and they're targeting the same part of the virus, so not surprising that they work the same. The biggest difference is, and they both require 2 shots about a month apart. The biggest difference is, as you probably have heard, the Pfizer vaccine requires a deep freeze, being packed in dry ice, and if you take it out and it sits around for a couple of days, it's no longer good. The Moderna vaccine can be stored in a regular old freezer. So that's an advantage to the Moderna vaccine in terms of just ease of distribution, but beyond that, if you had a choice of getting one or the other, there's really no difference between them. That's a complete toss-up.
So Jonathan writes in, I guess he's familiar with the trials that they went through, and he focuses in on the 5% of the vaccinated people in the trials that didn't get protection versus the 95% who did. And he asked, should it matter to me if I'm more like those who would be in the 5% category? Is there any way to understand that? And maybe you can explain that better to Jonathan.
Yeah, it's a really good question, and there's a lot of research that's going to go on into what it is about those people. Is there something that's predictable about it? Would they benefit from a higher dose of vaccine? One of the happy bits of news is one of the things we wondered is will the vaccine work in younger people with stronger immune systems, but not work as well in older people. Part of the reason older people are more likely to get sick and die is their immune systems begin to poop out over time. And so there was a concern that the vaccine might work in the people that don't need it as much and not work as well in the people at the highest risk. It turns out that that's not true. It turns out from what we've seen from both vaccine results, it works equally well in older people. But what it is about that 5%, in terms of it's their genetics, or did they get a particularly high dose of virus that just sort of overwhelmed the vaccine? That's not known yet, but it's important to say that there was a huge difference, not just in the number of cases, but in the number of severe cases. So at least, I think it was in the Pfizer study, when you looked at the people that got that did get infected despite getting vaccine, none of them got very sick. So the vaccine seems to be effective not only in preventing disease, but just as importantly in preventing severe disease. And if at the end of the day a few people still get COVID, but they feel fluish for a couple of days and then they're better, that's not so bad.
And he follows up with a question about blood type. Any indication about effects on different blood types?
I have not seen that reported. That's probably going to be in the ultimate papers that get published, but it wasn't in the original releases that came out of the companies.
Very good. And, you know, on any question, there's a lot of different opinions on a lot of different sides. Suzanne writes in, why not basic nutrition, use of important herbs and supplements as a way to combat COVID-19? What would you say to Suzanne?
Just not been proven. Doesn't mean it might not make a difference. There does seem to be some impact of diet on one's immune system. It's perfectly prudent to pay attention to that, to pay attention to getting enough sunlight, and vitamin D seems to impact one's immune system. But you know, I sort of go by what the evidence tells us, and there's no good evidence that says that that any kind of differences in nutrition will make a difference in terms of your overall chance of getting the virus or getting sick. I'd say the caveat there is there's a very clear association with bad outcomes and obesity, and more than you would expect, more than we see in many other diseases. So there may be something about the way the virus sort of meanders through someone's body when they're particularly overweight. So that is something that you have some control over, and that's been a little bit of surprise how much of a risk factor obesity has been.
We're listening to Dr. Robert Wachter. He is the professor and chairman of the Department of Medicine at UC San Francisco. We've joined also by Dr. Civielli, who is the deputy health officer at Contra Costa, and Dr. Moss, who's the chief health officer of Alameda County. Dr. Moss and Dr. Civielli, a question comes in about who's going to make these decisions about who gets the vaccine first. Is the state of California going to set the rules? Is your medical provider going to set the rules? Any thoughts on that question from Gordon?
Yeah, I can jump in.
Really? Oh.
But
go ahead, Nick.
I think we're going to give the same answer, but I'll take first crack and then turn it over to Ori.
That's Dr. Moss from Alameda County. Go ahead, Dr. Moss.
So the CDC is going to be really establishing the priorities. The state does have some role. I at the local level, we're primarily going to be making sure that we are supporting the distribution, making sure that there are facilities that can access the storage requirements for some of the virus, but also making sure that we are within the groups, the categories that are prioritized, making sure that we are ensuring access to vaccine here in our counties. Ori, I don't know if you wanted to add to that.
Yeah, same thing. The CDC sets the guidelines. They distribute it to the state. The state has another task force that really is looking at how many healthcare workers are in each area and allocating the vaccines accordingly. They're also looking at where are there these ultra-low temperature freezers so they can decide where to send the Pfizer vaccine versus the Moderna. We have, in Contra Costa County, we have 3 of these ultra-low temperature freezers. And we are already in discussions with healthcare facilities for that first wave of vaccines, which is for healthcare workers and the elderly in nursing homes or assisted living facilities. So we're already setting up what we are calling these vaccine distribution pods, and we have a very active vaccination branch within the COVID-19 Operations Center.
Terrific. Great to hear. Selena writes in and says that if a vaccine is approved by springtime, does it mean that school children will be mandated to have that vaccine? She's concerned about that type of a mandate on her children. Dr. Civielli, any thoughts about whether this would be a mandate on kids to be in school?
We haven't gotten word from the state one way or the other on that. It may be that it's not mandated if they're doing virtual school, but it is mandated if they're coming to in-person school. But I'm not making a commitment there, and really that decision is made at the state level, not at the local level. So I don't know where that's going to fall. It could be that they'll want to see more prolonged safety and efficacy data before they make anything mandatory.
Okay, good. Stay tuned on that. Alicia writes in, and she's a proponent of the instant rapid antigen tests. She says, why can't the state of California, the county health officers, and amazing leaders like Dr. Wachter organize the state to approve, order, and distribute these tests for the citizens of California? Dr. Wachter, you have a fan out there, Alicia. What would you say to her about those rapid tests?
Well, first of all, thank you. I don't think that's my mother's pseudonym, so I appreciate that. We were late on that. They are now rolling out, and they're better than they were. We've also learned that they can be a little bit less sensitive, and it's okay, because we really want to know if someone is contagious, not necessarily that they have one viral particle in them. And so I think we are reaching a new stage where we have better, faster tests that are available, and I think this has been one where the relative lack of federal leadership has gotten in the way. I think we're going to see better and more fully thought out plans coming out of the CDC in terms of distribution of these more accurate tests, because we're going to find ourselves in this funny place for the next 8 months or so where some people are vaccinated, many people are not yet, and you may start seeing openings of businesses and other activities, maybe even schools, that are kind of like the sports leagues where, you can get in if you either have gotten vaccinated and demonstrate evidence of that, or have a rapid test that demonstrates that you're not carrying infectious virus today. But it's complicated on all sorts of levels and requires a real plan, and so I think it is something we should begin focusing more attention on.
And Joan writes in a related way. She wants to know about the meaning of a negative test. She raises this issue of the 2-week quarantine and how much you know about exposure from day 1 to day 6 to day 10, and if a test comes back negative, what does it really mean, and is it enough? Dr. Wachter, can you try to answer Joan's concern?
Yeah, it's really complicated. We're all getting an education in this as we go on. There are false negatives. It can be because you've been tested early, and it takes a little while before the virus reaches a level at which it will test positive. It can be because when they did the swab, they didn't get enough of a sample. But importantly, one of the principles of these new tests is that they are a little bit less sensitive, but the idea is that maybe they are, quote, false negative because you actually do have the virus in you, but they tend to correlate reasonably well with the level of virus that you have in you, meaning it's negative and it's wrong in a way because you do have COVID, but the virus being below the level of detection of the test, you're probably also below the level of virus in your mouth and in your nose to make you contagious. So really complicated to sort out, but it is important. For the most part, a negative test is believable. They tend to be right. But someone's having persistent symptoms that seem like they could be COVID, has a negative test, probably should be retested. Waiting a few days to be sure. In terms of using a negative test to say you're good to go, that is very tricky. And I know the CDC is looking at the possibility of saying, rather than you have to be quarantined for 14 days if you've had an exposure, that maybe if you're quarantined for 7 days and then have a couple of negative tests, maybe a few days apart, that may be enough to say you're in the clear. And I hope we'll get some more guidance on that because it's been a little bit vague.
And Kathy asks about someone who has recovered from COVID. Is there anything to know, first of all, can you get it again? Secondly, is there anything in testing that might still show it in your system, but you have recovered? Anything that you could say to that group of people who luckily have recovered?
Well, here's what we know about recovery. First of all, the evidence is pretty clear that 10 days after the onset of symptoms, you're no longer infectious. And so that's comforting because you may still have a positive PCR, a positive COVID test. And some people, we know, one of my colleagues was written up in the Chronicle, had a positive test for a couple of months. But that is certainly dead virus. It no longer is capable of causing infection. We also have come to understand this idea of long COVID, that some people, we tend in the beginning to think, well, either have it and get very sick, and unfortunately a few people die, or you'll get better. Few people will continue to have symptoms for weeks and months. And then there are concerning studies that show that you can identify abnormalities in the heart, for example, a couple of months out in a small but meaningful percentage of people. And at this point, we have zero idea what that means. It may be a big nothing, and they never have a problem, and it may be that they have heart consequences or lung consequences years out. It simply is too early to know. So all the more reason not to get it. Sometimes people look at the mortality numbers and say, oh, I'm 25. It doesn't matter if I get it. Very unlikely I'll die. That's true. But first of all, we've seen people die. And second of all, this idea of long-lasting symptoms and long-lasting complications that we don't understand are very real concerns.
And what about this? You mentioned 40% of people who have COVID are asymptomatic, meaning they don't show or reflect any of the illnesses from it. So that's a scary thing. It's probably one of the most scariest things about this virus to begin with, because if you have the flu, you're coughing, you're sneezing, you have a sense that you have a problem. But if you're asymptomatic, you don't. So there is a lot of worry about that from people who. And the question that Brian asked is, how often should you be tested for COVID, given this concern about asymptomatic situations?
That's sort of an existential question, unfortunately. First of all, you're absolutely correct. That is COVID's dominant superpower, and one we did not understand at the beginning. We thought it would be like the flu in that way, that if, that's why people were doing temperature checks when you came into work, which we now know are maybe a little better than worthless, but only a little. And so this is a real problem for us. So if you wanted to be 100% sure that you were uninfected, you would probably need to test yourself every 2 to 3 days, if you think about the sort of life cycle of COVID. Now, nobody is doing that, I don't think, at $100 a pop, unless you're on your way into play in an NBA ball game, or maybe going on into the White House. It's not a practical thing to do. That's partly why there's been so much focus on getting faster and cheaper tests out. And there are new tests that are coming down the line that may be, $10 a pop or $20 a pop. The dream is a home test, like a home pregnancy test, that you might just do, in the morning to see how you're doing. Now, if in the Bay Area the test positivity rate is so low that the chances that an asymptomatic person is infected is very low. It's on the order of 1 or 2%. It's probably even maybe in San Francisco, it's a little lower than that. It's about 0.5%. So it's a lot of work and money to be testing every single day. And I think by the time we would have sorted that out and have all the tests out and broadly distributed, and you're using it after you brush your teeth in the morning, I think by that time we'll all be vaccinated. So I think that, unfortunately, it is one of the problems with COVID. You can't be 100% sure that you or anybody else is uninfected, and the solution for that is wearing a mask.
Very good. As we finish up here, I want to note a number of people have written about economic relief, and we certainly feel the pain that so many business owners, people who are unemployed, are feeling, and they ask about whether or not the federal government's going to come through with different types of economic relief efforts. And I just want you to know, to Toby and to Sarah and to many others who have written in, that all of us are working very hard with our federal partners to try to get that relief for small business, for individual unemployment benefits, to our school systems and our local governments, which have been hard hit by what we're all experiencing. I don't have an answer for you. I don't think anyone on the call has an answer for you today, except to let you know that we're working very hard to try to provide an additional relief than what has been provided, because it is so necessary. Gentlemen, I'd like to close by maybe bringing up a question that a number of people have asked about the upcoming Thanksgiving holiday and the frustration that people feel about these restrictions and trying to figure out what they should do or not do. People coming in from out of state travel and the consequences of that, where they can go for information about the virus spread in places in which people may be coming. And I'm sure you all have thoughts about that And as we close, I want to give you each a chance to speak to that. If I could go to Dr. Moss, the Chief Health Officer at Alameda County. Dr. Moss, thank you for being a part of this conversation. And what would you say to those that are trying to figure things out for Thanksgiving and beyond?
Thank you so much for having me. And we know this is a time of year where people they're frequently traveling, they're gathering with family and friends, and really we are asking people to keep it small this year. Keep it to your household if you can. If you are gathering with other households, really limit the numbers of people. Keep things outside. Wear those face coverings, and just this is the year to be careful and to protect each other and protect your loved ones. Information about Alameda County COVID and all kinds of guidance, and including guidance about the holidays and travel, can be found at covid-19.acgov.org. And so certainly for residents of our county or people who are considering traveling, we recommend against it, but you can find information there.
Terrific, and thank you for your great leadership and participation with us today. Dr. Civielli, it's nice to have you back, and appreciate all the good work that you're doing in Contra Costa County. What would your guidance be to friends and family as we get into a pretty important time of the year for all of us to be together with family?
Yeah, like Dr. Moss said, same thing. Virtual gatherings are obviously safer. If you have to gather, keep it small, keep it outside, keep it short, keep the masks on as much as you can, and just remember, we're still hoping the vaccine data stays good, and then by next Thanksgiving we can have a really, really big celebration. So save it for next year, basically, and you can always follow our data. I'll give out our website again, coronavirus.cchealth.org, and you can see all the numbers and links to get tested there. And thank you again for the invitation.
Thank you very much. And Dr. Wachter, it's so nice to talk to you. You are an oracle of great wisdom that I've listened to and watched and learned from over the last many months. And I appreciate you being part of the conversation today and all that you are doing. Thoughts as we enter the holiday season from you?
Well, thank you, Senator, and thank you for your leadership, and I appreciate being on with the other guests. Nothing to add in terms of Thanksgiving. I think the vaccine news changes the dynamic in a way that I hope makes this a little bit easier, which is this will not go on forever. I think it's one thing to tell people to buck up, and we don't know when this will end, and we might have to do this again, for another surge and another surge and another surge. I don't want to be overly optimistic, but I think based on the data we have on the vaccines, I think we can now be quite hopeful that by next Thanksgiving and probably before that, life will return to something pretty close to normal, maybe not exactly. And before you make a decision about something like Thanksgiving, you really have to say to yourself, what if one of the people around the table is infected, does not know it, and gives it to grandma? I mean, that's not scare tactics. That is a legitimate thing that has happened thousands and thousands of times in this country. So you have to think that through and then make a reasonable decision about the right thing to do. And I think most people will do the right thing.
Well, thank you, Dr. Wachter and Dr. Civielli and Dr. Moss for your wisdom and insight. I know this was fast-paced. We tried to cover a lot of ground. There are dozens of questions we didn't get to, which is why I was going so fast to try to get as many in as I could. But you all have helped, I think, bring understanding to this difficult situation, and we'll continue to have these update calls as necessary so people can get direct access to smarter people than me and give them the deeper understanding of what we're dealing with. But I want to thank you. I want to thank all those who have listened and contributed to this conversation. You can hear a recording of this event on my website, which is www.sdo7.senate.ca.gov, and you can go back and hear something that you didn't hear clearly or want to get some additional information that you might have missed. You can go back and review that tape. I know that 2020 has been a challenging year for all of us. I appreciate all that people are doing to keep themselves safe, to protect their family and our greater community. one of the few silver linings of this pandemic has been seeing how so many people have come together for the good of all of us, especially those who are most vulnerable and most at risk. We hear good positive news about the vaccines are coming. Once we have them widely available, we'll be able to put this terrible chapter behind us. Until then, please stay safe, wash your hands, keep your distance, and of course, wear a mask. Thank you all for listening, and have a wonderful day.